Hello and welcome, it's Chris from Christopher Hall Training. Welcome to this week's tutorial where we're going to talk about lower back pain. And we're going to talk about the journey of overcoming lower back pain, because I work with a lot of people that obviously have a bad back, and some people overcome it very quickly. That is the few though. Most people, it's a journey that you're on. And that's in some ways how you have to think about it. So one of the things I do to start with is I take people through a sort of subjective testing process or assessment process where I ask questions like, how often do you feel the pain? Is it daily? Is it weekly? Is it hourly? Is it monthly? Whatever it might be. How intense is that pain? Is it in the morning, evening, afternoon? So what I'm trying to do is I'm trying to build a picture of where that person is. And what it gives us an ability to do, it's a means of testing and measuring what we are doing. And this is something I suggest for everyone to do. You don't necessarily need to go and see a professional. You can literally answer those 3 or 4 questions very quickly. So how often do you feel the pain? How intense is the pain? When during the day do you feel the pain? Those are 3 very simple questions that what it gives you an opportunity to do is you might be experiencing the pain daily. It's a little bit more in the morning than it is in the evening, and daily it's at about, if 10 is excruciating pain, it might be at about a 6 or a 7. So let's just go with that scenario to start with. What we then do is I would then go about doing a physical assessment, finding out a little bit more about the person's back pain. And what I would then start to do is then start putting in strategies, exercises, stretches for that person to do. And then every time they come back to see me on, say, a weekly basis or a bi-weekly basis or whatever it might be, I will then repeat those questions. Okay, how often are you feeling the pain? How intense is the pain? And when are you feeling it during the day? Now, if they are coming out exactly the same, so they still feel it every day, it's still at about 6 or 7, and they still feel it more in the morning than they do in the evening, then what I understand is that what we're doing isn't necessarily working, so we have to change strategy, we have to adapt. So they go away for I give them a few more stretches, exercises, whatever it means, we change what they're doing, and then what we do is they come back in another week or 2 weeks or month or whatever it is, and then I again ask them the same question. How's your back feeling? How intense is the pain? When do you feel it? Is it more in the morning? Da, 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 da. And what I'm looking for is, I'm looking for progress. I'm not looking for, I'm now not ever feeling back pain again. If they're feeling it daily, can we get that to weekly? Can we then, once we've got it to, I'm feeling it, twice weekly, can we get that to once weekly? Can I get that to once every 2 weeks? With the intensity of the pain, can I start reducing the pain? Because this is how most people overcome lower back pain. And as I will mention in many other tutorials, all of my online training, all of my ebooks, my free downloads, my face-to-face services, be it back pain assessment, personal training, sports massage, whatever it might be, all of it is geared towards progress. Yes, sometimes I get a freak success where one week they come in and then the next week it's like, well, no, I haven't felt anything. It's been fine. That's sort of like I would describe as the minority. The majority is very much a slow progress over weeks, months, and potentially years. So it's trying to wean the back pain out of them. So what we're trying to do is we're trying to avoid any pain triggers. We're then putting in strategies in place to start building the core up, building the hips up, building the hip and spine hip mobility and stability, and then spine stability. So all the time we're gearing towards weaning that lower back pain out of that body. And that's exactly how you have to think about it, because the amount of people that come up to me that, in a sense, they think, well, I've got back pain, I'm just stuck with it. That's not necessarily true, because if we can wean it out, if we can get it from a daily pain to a weekly pain, or a weekly pain to a monthly pain, or whatever it might be, if we can start reducing that, we are starting to overcome lower back pain. So it's just a case of knowing where we are, being then able to put strategies in place to start moving us towards being pain-free. And then that can happen over a period of weeks, months, and potentially years, depending on the type of back pain. But what we have got to be able to do is be patient, and we have got to be able to test and measure what we're doing over a period of time. So hopefully that gives you a better idea of what a back pain journey looks like and feels like, and potentially gives you sort of a template to be able to work from. So just start off by asking some very simple questions. How often do I feel my back pain? How intense is it? When do I feel it in the day? And potentially what activities trigger it? So what we can then do is we can start to reduce the intensity of the pain, reduce the frequency of the pain. We start understanding that it's potentially in the morning and it's when I get straight out of bed or whatever it might be, or when I'm lifting a box, when I'm sat in my car, when I'm sat on my desk. That helps us know where we are. Then we are in the best place to be able to take ourselves to where we want to be, which is pain-free. But we've got that journey in between where we've got to reduce it over a period of time, rather than it just be I've got back pain one day and now I'm pain-free, because that is the few. If you're one of those lucky ones, then that's great. But most people have to go on that journey, and you have to keep testing and measuring all the way along that journey until your back pain is reduced and potentially eliminated. So many thanks for watching. Hopefully you found this helpful. If you want to find out more about webinars, ebooks and online courses on this subject, then please just go down into the description below, click one of the links, download an ebook, download a free download, enroll in the online course. It would be great to have you on board on any of those services. So my name is Chris from Christopher Holt Training. I will speak to you in next week's tutorial.